Hello, I'd like to say welcome to Dr. Nancy Young, who is one of our expert speakers for the Substance Use During Pregnancy and Family Care Plans Knowledge Lab. Dr. Young, welcome. Why don't you start out and tell us a little bit about yourself and your current work?
Thanks so much, Becky, and thanks for the invitation to share with the audience today. I'm the executive director of a national nonprofit, Children and Family Futures, and we work on the public policy issues that affect children of parents with substance use problems. So, this aspect of prenatal exposure is something that we've been working on for 30 years.
Wonderful, thank you. Can you share with us a little bit of about your work on the model law?
Sure. I was happy to participate like others that were part of the work group. We reviewed many drafts, offered suggestions, had some areas of the law that we didn't necessarily all agree upon. So it was important for us to state like our perspective and our experience, our professional background that brought certain areas to light about some of the challenges that states and communities have working across systems with protecting children and ensuring recovery for parents. So it was lots of reviews and lots of comments that were offered.
That's great. Thank you, Dr. Young. So, thinking about your work on the model law and your work day to day, can you talk to us a little bit about this topic? So, what are some of your insights and highlights from your work in the field in implementing policy, legislative, and practice changes to improve outcomes for families impacted by prenatal substance exposure?
I think one of the most important pieces of this is that if we're waiting until the time of delivery or hospital admission, we've missed the boat. I think I first became aware of a community in Burlington, Vermont, that had an initiative in place that was identifying pregnant people with substance use problems, primarily opioid problems in their community, well over a decade ago. And as I sat through the meeting, like light bulbs went on saying, this is completely new practice. No one that I knew of was doing something like ensuring that the family had a plan before the birth of the baby and that Children's Services was involved in the month prior to the due date to ensure that the home assessment was done, that resources were in place, that there was an effort to make sure that the family was supported before birth. And that has really carried over into our work that we've done in providing technical assistance to states, tribes, and communities about really looking at the engagement of pregnant people in services prior to birth, having a plan in place, having good communication between the different systems about the family's status and their engagement in creating a family care plan so that there's not the knee jerk reaction at the time of birth and the way in which child welfare services, child protective services are charged with providing safety for the children. If there's good communication and effort prior to that, they're not the last to know that this is a baby who may experience withdrawal symptoms, who may have challenges, who may need additional support as the family transitions to home. So that whole continuum of prenatal care, the birth event itself, and then importantly, the postnatal care and making sure that those referrals that are called for in the Child Abuse Prevention and Treatment Act are actually closed loop referrals, that somebody gets the family care plan, that they know that this is an infant that may or may not encounter challenges. But if they do encounter challenges in the preschool era or age developmental stage, that somebody is aware that, oh, they should be looking for these other kinds of neurodevelopmental effects that may have longer term implications, frankly, often from alcohol exposure, which co-occurs with other substances. But making sure that a pediatrician, a community agency that's working with the family is aware that this is something that may manifest for the child and that there are interventions that are put in place and that they're the right interventions. So that whole continuum, I think, is what becomes so important to implement in a community.
That was wonderful. So well said. Thank you so much. Dr. Young, I just want to say thank you for taking the time to help us to get to know you a little bit better. And we look forward to continuing the discussion during our Knowledge Lab on November 16th. Thank you, Dr.
Great.
Young.
Thanks so much.